Welcome everyone to today's webinar, Innovation and Risk in Urine Sampling. I'm Dr. Christy Campo, and I'm delighted to guide you through today's 30-minute session where we will explore the current standards in urine specimen collection and look at the groundbreaking innovations in this field and specifically the advantages of UriCap Female. Our objective today is to provide you with an expert global insight as well as practical knowledge that can significantly improve both patient care and infection control in your healthcare setting. So let's get started and allow me to introduce our guests today. First is Sana Yassin. Sana is a registered nurse with 10 years of experience in both cardiovascular and wound management. She earned her master's degree in public health and a specialization in health promotion and risk management. She is one of the inventors of the UriCap Female and the only registered nurse on the team. She serves in the role of a clinical support coordinator and product expert with TillaCare in Israel. Welcome, Sana.
Thank you for a nice introduction, and thank you for having me here today.
Thank you. We look forward to it. Also, let me welcome, please, Dr. Michael Cohn, MD and CEO of TillaCare. Dr. Michael Cohn is an experienced CEO, chairman, and founder of multiple successful international businesses. In his career as a physician, he has combined his seasoned leadership with visionary and entrepreneurial mindset in both industry and philanthropy. He was trained and certified as a medical doctor in Stockholm, and then after years of clinical activity, he took leadership of the family's innovative and high-tech distribution business, which he exited in 2014. For more than 10 years, Dr. Cohn has been innovating both male and female medical products, and a CEO and co-founder of TillaCare, he leads an international team who addresses a significant unmet need for women and their families globally suffering from urinary incontinence. On a personal level, Dr. Cohn loves design, marketing, and education, which all combine his many years of experience, allowing him to learn something new every day. So, Michael, welcome today.
Thank you for this nice introduction, Christy.
Wonderful. So I'm excited about today's event. First, we're going to talk a bit about standards and methods in urine specimen collection. So Sana, the first question is for you today. Could you describe the current standard practices in urine specimen collection and why they are the preferred methods in the clinical setting currently?
So it's an important question. And actually, it's important to start by emphasizing the fact that the way samples are taken from mobile and active patients like us is totally different from how they are taken from bedridden people. In the first group, we usually use either like the cup, midstream, or container, depends on the sample type, while the challenge is found actually among the second group, especially when these bedridden patients are suffering from incontinence at the same time, along with a lack of cooperation from the patient side. Unfortunately, the catheter become the first choice, and sometimes the only way that the staff can use it for obtain urine sample. In terms of the team preference, given the lack of alternative solution or alternative methods, I think that the catheter has been the most available method so far, meaning like the staff using the catheter, but regardless what they really think about it or what they do prefer.
Excellent. Thank you so much for sharing so generously on this important topic. Michael, can you explain a bit, what are some of the most common risks and complications that are associated with traditional urine specimen or urine sampling methods, especially concerning infection control and patient comfort?
Well, both these methods, the midstream sampling and the catheterization, has severe disadvantages. If we start with the midstream, which is very risk-free, that's the positive part of it. The flip side of that coin is that you have a very high contamination frequency, sometimes up to 50%, but in different studies between 15, 20, up to 50%, depends on, we don't know. Sometimes you may give them instructions what to do and what not to do, but it comes up with a very high contamination. And then that will then in turn not help the clinician to decide on the proper treatment of this one in this case. So this delays diagnosis and also increases unnecessary antibiotics treatment. The other, where you don't get as much contamination if you do it correctly, is the catheter that Sanna spoke about, which is then the most common in a hospital setting of incontinent patients who doesn't control the voiding, and you need to obtain a sample in a good way. But it's a sterile procedure, which it's a little complicated. It does cause pain and discomfort for the patient. And if you put it in and don't have the proper hygiene or the proper training, or you're young, you can also cause a cavity. It's very easy to, not easy to find the urethral opening, the meatus, and causes a secondary UTI. So the whatever you do, the midstream or the catheter, you have severe problems with both methods. And as an example, in Sweden, where they won't even put a catheter in because of the cavity risk, and they will use empirical data, meaning, or delaying, trying to lift the patients and have them pee when there's enough staff there, meaning you delay the diagnosis, or you treat empirically. And remember, 50% with cavity symptoms don't have a UTI. So here we see a lot of over treatment. So these are some points on the risk and complications and disadvantages of the two methods available.
Thank you both so much for sharing your valuable expertise on the current standards and the methods of urine specimen collection. So next, let's explore innovations in urine sampling. The first question is for you, Sanna. Sanna, could you please discuss innovations developed to mitigate the risk that Michael just spoke about, and that maybe enhance or improve urine specimen collection?
Well, currently no innovation in urine management in Israel, but I have seen recently some innovation around, basically when I go and attend conferences and exhibition abroad. And most of these technologies actually based on suction. And from my perspective, none of this technology can be performed in Israel market due to safety and usability issues.
Great points, Sanna. Thank you. Michael, did you want to add any comments to that? Build on Sanna's points? In terms of innovation in urine sampling?
Thank you, Christy. There are very little innovations. For hundreds of years, we have these two methods for urine sampling or urine collection. It's a very really hasn't been very much, and if you look at different patient groups, they've been suffering from this lack of innovation. Example, disabled, where you do straight catheterization and you have a lot of UTIs. So we really need innovation in this area, definitely. So I agree with Sanna here. There's very little on this side.
And what about for continent women or disabled women? Are there any innovations there that may make the market or the clinical area ripe for innovation?
Yeah, there is definitely a market. I mean, you have a huge need for taking a safe sample that is not doesn't have any contamination, and there are different cups that you can pee in, and some of them has been taken out of market because they really don't they don't really do any better than a regular midstream, but with a high contamination rate. But there is a huge need for disabled women to get a clean midstream, also for also for continent women. Also preoperatively, our study in Carmel in Haifa, we made a study, and the urologist there was driving that study because he wanted preoperatively to screen, and as you do before operation, screen to see that there's not an ongoing UTI. And there was just too much contamination, and then they had to cancel operations or treat preemptively with antibiotics, which is totally unnecessary, I think. Definitely.
Thank you. Thank you for sharing. Thank you both for discussing using your expertise on current innovations or even the lack of innovations in terms of urine sampling, urine specimens. It really sounds like both the healthcare arena and the global market are truly ripe and ready for innovation. So let's move next and begin to consider the challenges that you've mentioned and the lack of innovation discussed. Let's dive into the UriCap Female in terms of its ability to provide a solution to healthcare sectors around the globe. I have two questions, and first I'll start with Yassin. Can you explain what is UriCap and how it represents a breakthrough in urine specimen collection technology?
So yeah, let's talk about the UriCap. The UriCap Female itself is a small product, soft cup made of medical grade silicone, which is attached to a short extension tube and eventually to standard urine bag. So the inner surface of this cup should attach and covers the tissue around the urethra, and then it will collect the urine by create. And so I'm asking myself, how should it work? So by creating a seal, which is a natural force that keep the device connected in the place. Therefore, no adhesive product are needed. So in short, it's a small and smart product. I believe that this innovation in the UriCap brings to the health system breakthrough solution in the urine sampling after seeing a lot of cases, painful and traumatic actually attempts of urine obtained by insertion a catheter. First of all, I want to talk about enabling bedridden female for the first time using the UriCap to obtain a urine sample and avoid the invasive catheter. Secondly, the first urine actually you obtain from the UriCap can used for culture, since the cup that collects the urine surround the urethra and the urine doesn't come into contact with the labia.
Wonderful. Thank you so much, Sana. Next question. Michael, I would add, is there anything you want to add to that in terms of how it represents a breakthrough in urine specimen collection?
Yeah, I mean, yeah, as Sana mentioned, the unique design with I would say a combination with the adhesion that Sana mentioned, that you have a very close adhesion, so the E. coli will not get in touch if you have a proper cleaning with the urine, and the cup will just collect the urine. And also the other part of the design is keeping the labia or the skin folds out of the way. And here we can really say that we have a clean catch for the first time. So the UriCap really enables a clean catch, and because of the adhesion Sana describes, you don't need to have the invasive procedure. So here you mitigate both the negative sides that both these methods have, the clean catch and the catheter. You're not invasive like a catheter, and you don't have the contamination rate as you have with the clean catch. So here we actually mitigate both of these existing methods and their problems into a really revolutionary product that takes away these problems from the market, from the care, and it can have a huge impact on the healthcare system.
Amazing, amazing. I think you might have already answered my next question, was really all about how UriCap improves upon traditional methods of urine specimen collection in terms of safety and efficacy. But Sana, I think you had some information you wanted to share about the ER here on this kind of topic.
Yeah, I love this question. So there are actually plenty of stories that show the contribution that the UriCap can make. But we noticed that the most catheter insertion performed and done in the ER. So basically, the staff insert a catheter to obtain urine sample or to do a urine collection, and then they tend to leave the catheter in the bladder for a while, and usually until the patient go home. So adapting the UriCap in the ER, we think that's a game changer, where we can save suffering, pain, bladder, kidney injuries, and finally the infection itself. I think that replacing the catheter with the UriCap at the first station of the patient journey in the hospital can make a big difference.
Wonderful, wonderful. Thank you, Sana. And Michael, I think on that same tangent, could you share any success stories or even case studies where the UriCap has made a significant difference in patient care or infection control, for example?
Yeah, I mean, we've been talking about actually obtaining urine samples for culture, but don't forget the UriCap was designed basically just as a collecting device, and we have several case stories where especially disabled women have been using it at nighttime, and we have a case where she very openly shared her story, and she was quadriplegic. Her husband put it in place, and she used it for a year long, or a year and a half, 2 years, or a long time. She refused to put a catheter in at nighttime, and she said she lowered the rate of UTI with a half, because she didn't have any diapers, she didn't have to do self-catheterization, which created UTI. So she said it was really a breakthrough. She shared that, and we have other stories similar to that. But there's more than UTI. We also have skin infections, and from the wetness, being in a wet environment all night, especially for nighttime incontinence. So we get the response all the time when the skin is smooth and we don't have this wetness, and you can sleep through the night. Don't have to be woken up for a change of diapers or a straight cath. So this is other aspects of infection prevention or reducing stress for the patients and for the healthcare system. I mentioned Carmel Hospital, they want to use it preoperatively also in order to more safely diagnose any ongoing UTI before operating on the patients. And also, Sana mentioned, very important, the ER, but also we know that the catheters can be very deadly. It's the most common hospital-acquired infection in emergency, in intensive care, for example, where you put a catheter in to monitor urine, but it might be enough to have an external catheter that is safe and is not leaking, and you can save infections that can be very fatal in an intensive care environment. So here you have saving of antibiotics, saving on lives, saving on other types of infections, just because we have a device in the market now that is really collects the urine without leakage and without being invasive.
Wonderful. Thank you so much for sharing. Great points there. Sana, since you are the person who's the registered nurse and the product expert who's taking the lead on helping multiple Israeli hospitals adopt UriCap collection, what is training like for the staff who are implementing UriCap in the hospital setting?
So let's start that, like, the UriCap, it's simple and friendly product. From my experience in the training, I could see nurses do it from the first time, actually. You know, nurses dealing with the catheter insertion day by day. which is considered many times as a complex action due to patient contraction or anatomy malformation. So for them, UriCap is so simple actually, or so easy to operate. And our company actually provide high quality training document, LMS online course, videos, visiting the field, and follow-up process. So we really do the maximum our best to cover and to keep on the process.
Thank you, Sana. Wonderful. So sounds doable. We know it's doable. So let's think a little bit from the healthcare professional's perspective. Michael, this question is for you. Has feedback from the healthcare professionals and the market influenced the evolution of UriCap Female?
Thank you for that question. It's a very interesting question. That when you start with a new concept, you don't know where it's going to take you. It's always like that. It's not until you go into the market and show it to the people that actually use it, and they come up with ideas. So we did come up with this female external catheter that we knew collected urine, and we started. And Sana was part of that, bringing that into the market, talking to the nurses, showing it off, and the first one was for this seminar. It was a nurse coming to Sana. Yeah, it's great. We can use it to collect a clean urine sample. So it's now used in hospital in Israel for collecting routinely for collecting urine samples. Secondly, when we go to shows and visit doctors, they say, "Well, we have a problem with children, pediatric." The small children, you put a catheter in a little girl, they have fever, they come in. We need to know that there is not a UTI. We need to have a differential diagnosis, and we need to get the sample so we can treat it quickly before you get a renal infection, a kidney infection. So we're actually starting a collaboration with a major hospital in Tel Aviv and their innovation group to expand and get a pediatric device that we can start getting urine samples from infant girls 0 to 3 years old. They are also incontinent, and you really need to collect the sample in a very non-invasive way there. That's a big one. And finally, we have another in England. They started selling it in Britain. We have a very great distributor there, and they came back to us and say, well, we would love to do flow measurement, urodynamic measurements. Here we can collect the urine, we can see the speed, but we want to direct it right into the cup where we can measure the time volume relationship on voiding. And so we have a request from there and using a longer tube just to do that. So you can see the UriCap as a platform that the market has, helped us expand, because the concept is there, and then you can apply the concept in many different ways. So it's a great way to be out there, and that really helps us developing a product for the patient, for the healthcare, for the nurses.
Amazing. Lots of downline product opportunities. Absolutely. Sana, you could probably add some here in terms of healthcare professional feedback and market influence. What's your experience been?
Yeah, so I will talk about like the clinical research period. We were so lucky to have great nurses that was giving us continuous feedback from the field that actually helped us to understand more and more about the product. And this input actually has contributed a lot to have a better development and better product eventually in the field. So now we can say like confidently and proudly that we have a great product in the field. More than that, actually, wherever I go and like meet people, they can like be nurses, doctors, they share stories, requests, asks, and needs under the hat not only of being nurses, also being parents, families. And it seems to be that the urine management for all ages is essential, and there is still a lot to be done.
Wonderful. Thank you so much, Sana. Thank you both for your overview of the UriCap and for really explaining the multiple market opportunities. This can help many different industries in terms of urine specimen collection, use of UriCap, and opportunity for TillaCare. So let's move closer to the conclusion. And I'd like to give you each a chance to address something that you'd like the audience to know about the impact of adopting an innovative technology like UriCap in a healthcare setting. Sana, would you like to go first, please?
Yes, thank you. So innovation technology product I believe that it come to make life better and easier for both staff medical and the patient themselves. However, adapting sometimes seems to be challenging, exactly like the UriCap, but with proper training and patients' well-planned program for smooth penetration to the field can make big difference. The more the nurses are available to apply the device and make it part of their routine, the more they're enjoying the benefit of it. So our mission and our vision actually still far, and it's to reach the most of the incontinent patient in the world to make their life easier.
I love that. You know, as nurses, we live for that, and you're making it happen. Michael, what would you like the audience to know about the impact of adopting innovative technologies like UriCap?
Yeah, every time you come with a product, it has to make sense from an economical point of view, from the healthcare point of view, and the UriCap sort of fills all of these aspects, and patient safety and patient health. So we've had it in hospitals, and the value committees agree with us that this is really giving value to the healthcare system. Infection prevention, for example, is a huge problem. You want to reduce antibiotic use. You want to decrease hospital-acquired infections. All this costs a lot of money and suffering for the patients. So UriCap here is a game changer. We spoke a lot about that, decreasing antibiotics use and reduce hospital-acquired infections. And it's not often, I mean, to me, this is like, I'm not, you see on my gray beard, I've been around for some time, but for me, this is a really, to be able to be part of this and really make an impact in the healthcare system is a real benefit and a real honor. But there are challenges here, because in the end, there is a resistance in the system. There's a lot of money. There are a lot of big players, and you need to play with them or against them or getting around them in order to get your innovation into the market. It's not that easy, and the healthcare system had a lot of stress due to COVID the past year. So it's been a huge challenge. But in the end, if we don't do this, the patient has to pay, and we have to all to pay if we don't bring innovations into the market, and it has to happen, definitely. So
thank you for sharing. What I hear is that the patients deserve this, that there are hurdles, but we've got a very tenacious global team that's ready to make it happen. So as we conclude today's webinar, I just want to let you know a couple of things. One, all registered attendees will automatically receive a copy of TillaCare's white paper, Innovation in Risk and Sampling, really highlighting the evidence that supports adoption of UriCap for the purpose of specimen collection. And if you're watching this section later, recorded on YouTube or on Facebook, simply email support@tillacare.com and you'll get a copy of that white paper. So as we conclude today, one, I want to thank both guests, Dr. Michael Cohn and Sana Yassin, for joining us today and sharing their expertise. And then, thank you. And we hope that the webinar has provided all of you who are listening today with an understanding of both current practice, of innovation in urine specimen collection, as well as the advantages of UriCap and the important considerations that you have to take as clinicians and leaders when you consider the successful adoption of new evidence into your healthcare institutions. We also invite attendees and guests watching today to visit the two associated websites, TillaCare.com, the maker of UriCap Female, where you can find everything you need to know. And additionally, if you want to focus only on UriCap, UriCap.com. Both of these sites are available. And if you have a question for one of these amazing guests today, a CEO, Michael Cohn, you can reach out to him here on LinkedIn or email him, michael@TillaCare.com. And Sana, our amazing product expert and innovator, Sana can be reached by email, sana@TillaCare.com. I thank both of you for joining us today.
Thank you, Christy.
Thank you. Thank you, Christy.
That will end our stream. Thank you so much.
Thank you.